Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel, which channel is for everybody, for the medical students, medical doctors, patients, for the common man. Everybody has very good things in my Ayurveda Academy channel. My dear friends, today we are going to continue the series of Ayurvedic Srotas Parikshan, which is very important part in the Trividha Pariksha, in Ashtavidha Pariksha, in long case, in short case for the medical students. Okay. So Srotas concept is like a channels. There are 13 important channels in our body. Pranavaha Srotas, Annavaha and Udakavaha Srotas, and then Rasa Rakta Mausmed Asthi Majja Shukravaha Srotas. 7 tissues, they have their own channels where the all dhatu pachana prakriya, metabolic process takes place. And then there are the 3 srotasas which are having the waste products. For example, Mutrava, Purishava, and Svedava Srotas. In Ayurvedic Samhita Granthas or the compendia, especially like Charaka Vimanasthan, there is a separate chapter regarding the Srotasa, which is called as a Sroto Vimani Adhyay. Chapter number 5. Sroto Vimani Adhyay. Write down. Charak Vimanasthan, chapter number 5. There you get the Sroto Dushti Karana, causes of why the Srotas is disturbed or having the pathological conditions. Then there are also the Sroto Dushti Lakshana. What are the symptoms or signs when that particular Srotas is being disturbed or the in a pathological state? So, my dear friends, today we will discuss about the Rasavaha Srotas. As you know very well, that when our primary digestion takes place, we take the food, like for example, Shatarasatmak Ahar, Panchabhutik Ahar, in Ayurvedic terminology, balanced diet we take, that we engulf, and then the Pachana process starts with like Bodhaka kapha is there, then inside there is a Pachaka Pitta, Kledak kapha. All these factors are there for the proper digestion of the food. And the food processing going on, and then Annam Grannati, Pachati, Vivecheti, Munchati, and finally the nutritious Sarabhaga, essential part, essence part has been taken by the body and it is circulated from the heart to the different channels. For example, when the ahara rasa reaches to the rasavaha srotas, then from poshaka, that nutritious part, final rasa dhatu is manufactured. Okay, so rasa is the first body tissue according to Ayurveda, and for all the depending next chain of that dhatus are responsible or is a effect of the normal development of rasa dhatu. So we will discuss how that rasa dhatu is examined at a practical level. So, my dear friends, first is a darshana, then sparshana, and then the prashna pariksha. Trividha pariksha, in every srotas, you must do darshana pariksha, sparshana pariksha, and prashna pariksha. Darshan is inspection, sparshana is a palpation, percussion, and auscultation, and prashna is like interrogation and history taking. This darshana sparshana prashna trividha pariksha done at the two aspects. One is a prakrit, that is physiological aspect, and another is a vikrit, that is pathological aspect. Darshana pariksha, prakrit aspect related with the rasadhatu. The nourishment of all body components occur through the circulation of nutrients by the rasadhatu. That means if we want the good quality raktadhatu, if our erythropoiesis process should be very proper, then basically whatever the moving with the blood circulation or the plasma, that nutrients like for example iron or proteins or the thyroxine hormone, they should come in a proper manner to that particular bone marrow or to that particular liver or to the spleen, and then the erythropoiesis will take place properly. So this is the function of rasdhatu, to provide the nutrients to each and every dhatu as per their requirement. Rakta dhatu will depend on the loha or the iron. Then Mausa dhatu may depend on the protein content. Then Meda dhatu may depend on the fat content. Asti dhatu may depend on the calcium. So all these nutrients are provided through the rasadhatu. To examine the functions of rasadhatu, the following organs are basically tested or examined. Like for example, heart. Heart is called, every channel has a mool or controlling part. For example, rasa dhatu or Rasavaha Srotas has the Moolasthana as Rudaya and Dashavahi Dhamanya, or Rudaya and Rasavahi Dhamanya. So, for example, Rudaya means heart and Rasavahi Dhamanya or Dashavahi Dhamanya means blood vessels. So, we have to check the proper functioning of the heart. Then you have to check the skin, because this is what you can say the external, what you can say the site where we can judge the internal quality of rasadhatu. Because if rasadhatu is disturbed, rasadhatu is basically liquid in nature. So naturally, like udak dhatu, like a proper water, that rasadhatu is also responsible to maintain the water and electrolyte balance in our body, which can be checked by the color, complexion, and texture of the skin. Then you have to also look for the blood vessels, because they are the controlling parts, moolasthana. Now, just for your interesting purpose, I am checking the comparison in between udak and the rasavaha, udakava srotas and rasavaha srotas. For example, when we talk about skin, in the dehydration, udakava srotas is affected because there will be definitely dehydration, and that will be interpreted temporarily on the skin, because skin becomes dry and skin become inelastic or non-elastic. Elasticity is totally lost. But when we talk about skin and the Rasavaha Srotas, naturally there is a long-term benefit to the skin by the Rasadhatu. For example, to maintain the normal texture, complexion, and color of the skin, Udak Sirf only is not responsible. Rasadhatu is mainly responsible. Also, Rasadhatu is always carried with the blood naturally. Many skin diseases are also related with the Rakta Dhatu as well as to the Rasa Dhatu. So when the quality of Rasa Dhatu is good, naturally your blood also be very pure, and there will be less chances to get the skin diseases. Next, when we talk about Tarpana and Prinana, that means the instant hydration signs or the symptoms. Instant energy is called as a Tarpana, and in the mind level it is called as a Prinana. Tarpan is for the physical body and Prinam is for the mind level. Okay. So in Udakava Srotas, when there is a typical dehydration in the summer or with the diseases like loose motion, you will get the dryness of the tongue and dryness of the palate. But Rasava Srotas, this particular damage generally develop in the long-term effects. Like example, the person becomes irritable at all the times. He may have the depressions. He may be gradual loss of freshness, energy, and all this enthusiasm has been lost when there is a problem with the Rasava Srotas. So these problems are the little bit longer duration and chronic in nature. Okay, because Rasadhatu is a continuous manufacture and wear and tear is going on, and Dhatu is always Dharana Dhatavaha. They make the body and mind stable. Okay. So Udakava is for instant and Rasava is for the long-term benefits or long-term damages. Okay. Skin, compare Rasa and Raktadhatu. In Udakava Srotas, when the skin is having in problem, then skin become dry. It can become cold to touch, hypovolemic shock, then gradual black discoloration of the skin very slowly. Suppose example, 5-10 days the person is doing fasting, then that effect particularly can be seen. But basically, if we talk about the Rasava Srotas, you can get the discoloration, which is called as a Vaivaranya in Ayurveda. Like for example, red color may come with the erythema, yellowish tinge in the jaundice cases, bluish coloration to the tongue or the lips with the cyanosis, then skin itching may be there, then loss of sensation, like example, leprosy patients or Kushtavyadhi, then there may be stopping ischemic conditions of the limbs or ischemic condition of the skin, then that can be finally come into as a gangrene problem. Gangrene is a koth in Ayurveda. Next, Darshana Pariksha, we will continue with the Rasava Srotas. First, you have to give the importance to the heart. So cardiac impulse, as you know, fifth left intercostal space, mid-clavicular line. This is the place where you can get the heartbeat. You can see the beat, you can palpate the beat. In obese patient, for example, this cardiac impulse, cardiac pulsations may not be visible because of the deposition of the fat on the chest. Signs of nourishing activity, which is called as the prinana, instant energy, a cheerful expression on the face, then firm and healthy skin, a rosy complexion, radiance, and a strong pulse. This indicates that your Rasadhatu or Rasava Srotas is of good quality. Regarding the pulsation of the blood vessels, is there any observed any pulsation in the neck region? So that is something abnormal, because in a normal condition, if you ask the patient to turn the face on one side and if you see any pulsation or carotid or the calf, then that is not normally seen. But if it is pulsating more, it indicates there is some obstruction further, that means in the heart, and that is repercuting as a more severe pulsation in the neck veins or the neck vessels. Okay. Now next, the cardiac impulse is more prominent on the left side if the condition and slightly displaced downwards, then that is maybe because of the cardiomegaly. Heart size becomes more and it is shifted to the down. The cardiac pulsation or impulse shifted more on the right side. So is there any pathology or the fibrotic changes in my right lung, which is what you can say, the taking that heart impulse to the, that means is like a staging. Okay. Neck veins, if the neck veins are endowed, then you must suspect that there may be some obstruction in the Rasavaha Srotas circulation or Rasa Dhatu circulation. Compare the size and color of the right and left hands and also the feet. Is there any atrophic changes are there, discoloration or ulcers are present that can indicate the problems of Rasavaha Samvahana. It is called as the Rasa Samvahana. Usually Rasa Samvahana and Rakta Samvahana, they are clumped together. Always there is a Rasa Rakta Samvahana, that nothing but the plasma and the cell circulation in the body. Sparshana Pariksha, Darshana, Sparshana, Prashna. Sparshana means to touch, tactile. Confirm the findings of inspection by palpatory method. You have to just reconfirm. For example, the condition of the cardiac impulse and the state of the skin, you have to touch over there and see the exact, we are correct with the inspection or there is some change. Rasadhatu circulation occurs due to the contraction and relaxation. Contraction and relaxation of the heart. This can be indirectly examined by your pulse examination, Nadi Pariksha. To assess the size of the heart, perform the percussion. You know this percussion method. These are the, my videos are very interesting. You don't forget to check my allopathic and Ayurvedic examination videos on my mobile app, Clinical Examination. You must purchase that app. Is very interesting. App download is very free. The name of the app is Ayurveda Academy, which you will get on the Google Play Store. Very good level of marking. You must download that app because it is totally free, and then see the different program Dr. Deshpande is putting over there in a very, very optimal prices, very low cost. Okay. To assess the size of the heart, do the percussion, the sound examination, that is the auscultation conducted with a stethoscope, that will give you the idea about normal heart sounds and abnormal heart sounds. Next is the Sparshan continuation. Abnormalities, moreover, if there is abnormality in the cardiac impulse detected to the tactile examination, the specific area, if there is a shifting or if there is a murmur, then you have to find out whether it is a mitral murmur, whether it is a auscultatory, that means what you can say, the systolic murmur, diastolic murmur, aortic murmur, pulmonary. So you have to detect each and every details of it. In the sound examination, that is with the stethoscope, auscultation, is there any abnormal or distorted sound like murmur, love, dub? This is normal, but love, dub, love, dub. This between is a murmur, a very rough sound. It indicates the abnormality in the cardiac valves, mitral valve and tricuspid valve and aortic valve. Can any abnormality be detected through the pulse examination? You can detect, even pulse examination can give you the idea about extrasystole, atrial fibrillation, sinus arrhythmia, extrasystole, tachycardia, bradycardia. But of course, that can be very well compared with the ECG also. Okay. Measurements of blood pressure should be taken to assess the fluctuations of abnormalities in the blood pressure, high blood pressure, low blood pressure, etc. Last but not least is the Prashna Pariksha, Prakrita, physiological aspect. Is the quantity of liquid substances in the diet is sufficient? Whether you drink water enough, you take the soup, buttermilk, fruit juices in your regular lunch and dinner time, because Rasa Dhatu is Drava Anusari. Write down this word, Drava Anusari. That means it is having the liquid predominance, more water in the Rasa Dhatu. Okay. Does the diet, because then only according to Samanya Vishesh Siddhanta, if you take the adequate liquids, then that quality of the Rasa Dhatu and Rasavaha Srotas will be good. If you are not taking the proper liquid supplements in your food, then your Rasavaha Srotas will be definitely not working properly. It will have some pathological problems, pathological changes. Okay. Does the diet primarily consist of sweet and soothing qualities? Because the Rasa Dhatu is also Madhura Rasatmaka and having the soothing quality. Okay. Does your food Lifestyle, Jivana Shaili or occupation contribute to the increased heat and dryness. Increased heat and dryness is a very, very bad for Rasadhatu, very bad for Rasavaha Srotas. After following a balanced diet, whether that particular person can experience increased enthusiasm and vitality after food. That means his ahara rasa is converting into rasadhatu properly. Okay. Do they frequently suffer from the skin elements? If the person is having lot of problem of skin at all the times, then definitely his rasa and raktadhatu are not functioning well. So there may be problem directly into rasa and raktadhatu, or it may be the problem with the indigestion and ama is getting formed. Because first digestion creates the ahara rasa. From ahara rasa, rasadhatu is formed. From rasadhatu, the raktadhatu is developed. So there is a chain. So you have to find out the base or the root cause of chain problem. Okay. Regarding the secondary tissue of rasadhatu, that means Ayurveda has explained about the each dhatu. During the metabolic process, there is a upadhatu and mala. Upadhatu is a secondary tissue and mala is a waste product. In every metabolic process, this happens. So, upadhatu of rasa are stanya and raja. Remember these two words, stanya and raja. Stanya is a breast milk and raja is like a menstrual discharge. So, you have to check these particular two things also, because that can also tell you about the prakrutatva or the physiological condition of Rasavaha Srotas. Consider the quantity, consider the quality, consider the functions of stanya and raja. Then, do certain factors contribute to the aggravation of the Rasavaha Srotas? Is there any specific causes? Does the consumption of excessively heavy, that means high calorie food, difficult to digest, or there are excessively fatty, oily food the person is taking, that is can be the problem for Rasavaha Srotas, because ama will be generated and that can cause the Sroto Rodha. Ati pravrutti sangova, siranam granthayopi va, vi marg gamanam chapi, srotasam dushti lakshanam. The general signs and symptoms or the pathological conditions are atipravrutti, excessive, sanga, obstruction, atipravrutti sangova, siranam granthayopiva, maybe thrombus, embolism like conditions, vimarga gamana, because of the obstruction, vimarga gamana, losing the main track, that can happen. Sango, atipravrutti sangova, siranam granthayopiva, vimarga gamanam chapi, srutasam dushti lakshanam. Okay, you have to check everything. Then psychological factors also affect your rasadhatu. Remember this condition. Excessive worry, excessive anxiety, mental stress, that will make a bad quality rasadhatu. Also, it will disturb the physiology of Rasavaha Srotas. Then, if the Rasavaha Srotas has become imbalanced, are there any indications or are there any symptoms? You have to check this symptom. Checklist is available in the Charaka Vimastan chapter number 5. In the last, I am going to read those particular shlokas for you, such as the loss of taste in the food, loss of appetite, indigestion, feeling of the heaviness in the body, occasional fever or body stiffness, pale complexion, low blood count, low hemoglobin count, weight loss. All these are indications that your rasadhatu is not good, Rasavaha Srotas is not good. Does importance manifestation of premature graying? That can also happen with the rasadhatu. Are symptoms such as exertional dyspnea, chest pain is there? Is there any previous symptoms of the heart diseases like myocardial infarction because of the chest pain and fatigue and excessive sweating history is there? Is morning pedal edema is there? Sorry, the pedal edema, better way you can say in the evening is more predominant, not in the morning. Morning, the periorbital swelling is common in the kidney diseases, but this pedal edema is more in the evening. Okay. After, of course, after getting from the bed, it can be seen. Okay. Commonly caused by the cardiac diseases or anemia. Now, best investigations that you can do to support your clinical diagnosis or provisional diagnosis, you for the Rasavaha Srotas, I will request you to do the blood pressure determination at all the time, first time and follow-up time, resting ECG, electrocardiogram, stress test, 2D echo. In 2D echo, you have to read for ejection fraction, which is very important. Ejection fraction should be minimum 50. If it is less than 50, it indicates weak heart. And then you have to go for angiography. It will clear you about the one vessel disease, two vessel disease, three, how many diseases are affected with the thrombosis. And then you have to go for one vessel, two vessel, you can do angioplasty. If three vessel disease is a CABG, coronary artery bypass grafting. My dear friends, of course, 6 and 7, these points are not investigation. These are the points of treatment. Now, let me tell you, my dear friends, don't miss this particular interesting things that we are going to see the Rasavaha Srotas Dushti Karana causes from the Charak Vimanstan chapter number 5. Guru Shitam, Guru Shitam, Atisnigdam, Atimatram, Samashnatam, Rasavahini Dushanti, Chintyanam cha Atichintanat. Okay. So guru means heavy to digest. Shita, very cold food stuff all the time, not freshly cooked. Always from the freeze items, air conditioning, cold drinks. This can damage rasadhatu or rasava srotas. Ati snigdha ahara and in excessive amount, ati matra. Also, rasadhatu utpatti is also disturbed because of the pathological condition of annavaha srotas, because that is a prior type of srotas which is giving you the best ahar rasa and best rasadhatu. Okay, then whichever the causes of annavaha srotas dushti are also the responsible for rasava srotas dushti. For example, vikrit, some type of the ahar rasa is developed because of that problem in the annava srotas. Now, what are the dushti lakshana of rasava srotas dushti? Ashraddha, okay? Ashraddha, aruchi, asya vairasya, arasadnyata, rullas, nausea. Then gaurava, heaviness in the body. Tandra, always drowsiness, always sleeping feeling. Sangamardo, jwarastamaha, sometimes feverish type of feeling in the body. Pandutva, anemic condition can occur with rasadhatu. Remember, Srotasamrodha, Klaibhya, oh my God, erectile dysfunction also can take place because of the rasava srotas problem. Then Sadha, Krishangata, the body will not develop because when rasadhatu is damaged, all the next dhatus, Rakta, Mams, Med, Asti, they are getting the problem. So these are the Rasapradoshaja Vyadhi. Nashaugne, Agninash is there. Ayatha Kalam Valayaha Palitanincha, that premature aging is always done, always happening with the rasadhatu or rasava srotas problem. Don't forget these things. My dear friends, this is all about our today's discussion with regards to the rasava srotas examination. So I request all of you, if you have any health problem, Ayurveda Academy has a team of doctors with Ayurvedic pediatrician, Ayurvedic physician, Ayurvedic gynecologist. Everything is there. Ayurvedic neurologist. So you please WhatsApp for the paid online consultation on 9226810630. वैधानिक इशारा कौन सी भी बीमारी में यथावश्यक यथाकाल वैद्य की सलाह लेना जरूरत है. I wish you all the best, but before that, I request please like this video, share this video, and don't forget to subscribe my YouTube channel and press the bell button icon to get the notification of such nice and interesting videos. My dear friends, thanks for your kind support and help, but I wish you long, healthy life